Did you know that there are 5 common reasons why women during pregnancy become constipated? Some of them you can't prevent, but others you can help do some things to mitigate the constipation and also the severity. So let's talk about why constipation occurs during pregnancy and also what you can do about it. Progesterone is a hormone that is steadily on the rise during pregnancy. But progesterone also can cause for increased laxity in the body. When it comes to laxity, relaxin is another hormone that tends to get most of the attention. But progesterone can be just as impactful, especially with your digestive tract. Progesterone is known to slow down digestion. This can give your body a chance to have actually absorb more nutrients, but it also can decrease the speed in which things are moving through the gut, leading to constipation. There are also some mechanical reasons, so basic physics as to why constipation can occur during pregnancy. As the uterus continues to grow, that can actually cause for increased pressure along the rectum. So as the baby continues to grow, some women will notice they're not able to consume as much food simply because of the space that is being taken up by the baby. Other women will also know they probably have to have a bowel movement more frequently or at least have the urge because of the pressure that can occur within the rectal region. Our eating habits change as well. Some women may notice that they're not consuming as much fiber, and fiber is an important component of managing constipation. During pregnancy, if you're someone who has cravings and if anything that has a good amount of fiber isn't on that list, make sure you're doing what you can to increase the fiber that you're getting in. The best thing to do is to try to get 5 servings of fruits and vegetables every day. Now, I'm not saying 5 servings of each, but if you can manage that and your body tolerates it, hey, do you. But between the two, you want to try to get 5 servings, with vegetables being the more prominent one. Make sure you're also looking at whole grain foods. Whole grains can help for your body to be able to, one, get a more nutritious meal, but also your body does a better job digesting it as well. So when you're looking at the ingredients on packages, make sure you're avoiding the items that say refined flour or refined wheat. Fiber is something that's going to be important with you managing constipation, and our eating habits change. So make sure you're getting enough. Do you know how much water you drink outside of pregnancy? Most people don't, and that's okay. But during pregnancy, you may notice that you will need to consume more water. But you also may notice that you have the urge to pee and urinate more frequently. Well, this is common because, as we mentioned earlier, the uterus continues to grow. So it's not only causing additional pressure on the rectum, but it can push on the bladder as well. As a result, some women begin to not consume enough water. Make sure that you are still sipping water throughout the day. If you're sipping the water throughout the day, you can ensure that your body is better hydrated and also minimize the urge to constantly run to the bathroom. In order to know that you're well hydrated, just as outside of pregnancy, you want to make sure that your urine is a light, pale yellow color. So grab a water bottle and keep track as to how much water you're actually drinking. The amount of water that you need can directly differ from someone else who's pregnant simply because of your body composition, your activity level, and also the area that you live in. So make sure you customize your water needs directly for you. You probably have already heard the importance of taking a prenatal vitamin during pregnancy. If you haven't, make sure you talk with your provider. That way you can find one that will work well for you. With your prenatal vitamin, you should notice that you have something in it called iron. Iron is extremely important for various functions in our body, both during and outside of pregnancy. However, there are times where iron can cause constipation. If you're noticing increased constipation in regards to your supplement, don't stop taking it. Instead, talk with your provider to see if there are other options for you. Also consider using some of the tips and tricks that we give you to help manage that constipation. Like I said, iron is an important nutrient that your body needs. You want to make sure that you're getting enough iron. Another reason why women during pregnancy may notice constipation is because of the decrease in activity level. Now, if you're someone who has not noticed a decrease in your activity, awesome. Please keep it up. However, if you're noticing that it's been a little bit harder for you to move around, make sure you're talking with your provider and also make sure that you are seeking out the necessary services so that way you can stay active during your pregnancy. Why? Because exercise during pregnancy not only helps with mom having an easier labor, making sure that mom does not gain unnecessary or excess weight, but it also can help with the heart health of both mom and baby. And it can help you manage constipation. Hopefully this information was helpful for you as you look to try to navigate constipation and hopefully prevent it during your pregnancy. Constipation can lead to several different issues, including increased pressure on the pelvic floor and straining. Straining when you're having a bowel movement can put you at higher risk for hemorrhoids and prolapse. So let's do everything that we can to help protect your pelvic floor by using some of the tips I gave you. Making sure that you're getting enough water by looking at the color of your urine, making sure you're getting enough fiber by eating a well-balanced, nutritious diet that has whole grains, whole foods, including vegetables and fruit. And also make sure that you are exercising. Exercise can be a wonderful way for your body to combat constipation. There's one last tip I want to throw at you, and that is the importance of getting enough sleep. Let's be honest. Sometimes during pregnancy, getting the right amount of sleep can be a challenge. Just do the best that you can. So that way you can make sure your body is well rested. Sometimes the quality of sleep is more important than the quantity. So if you're having short bouts during the night and even needing to take naps, that is okay as long as you are getting good quality sleep. If you're not getting enough sleep, your body can end up in a mode of stress, which can make constipation worse.